What's driving this surge in homelessness and drug abuse? And what can Canadians do together to reclaim hope from the chaos? Tonight, we journey to the heart of Canada's most urgent social crisis, seeking truth, hope, and a way forward. Chapter 1. Canada's Changing Face. Canada's major cities are undergoing a transformation that few saw coming. In neighbourhoods once defined by bustling cafes and families, the landscape is now dotted with tents, sleeping bags, and hastily built shelters. At the root of this change is a tangled web of economic, social, and health-related causes. Housing prices have soared far beyond the reach of many Canadians, making even modest apartments out of reach for people with full-time jobs, let alone those facing illness or unemployment. Meanwhile, wages for the working class have remained stagnant, and government assistance hasn't kept pace with the cost of living. COVID-19 acted as an accelerant, closing businesses and erasing jobs, while also straining mental health services to the breaking point. Suddenly, thousands who once lived paycheck to paycheck found themselves unable to pay rent, with few safety nets to break their fall. For some, one medical emergency or a family breakup was enough to spiral into homelessness, a reality that now affects over 235,000 Canadians annually. Chapter 2. The Opioid Storm. The rise of the opioid epidemic has cut a devastating path through Canada, touching every province and city, rich and poor alike. It began with the overprescription of painkillers in the early 2000s, as pharmaceutical companies promoted opioids as safe and non-addictive. Thousands of Canadians became dependent, and when prescriptions were finally restricted, many turned to street drugs, heroin, then fentanyl, and now even more potent synthetic substances. Fentanyl, cheap and incredibly powerful, is mixed into other drugs without users' knowledge, dramatically increasing the risk of overdose. Organized crime networks and local dealers capitalized on this trend, making Canada a primary market. The results are catastrophic. British Columbia declared a public health emergency in 2016, and since then, overdose deaths have risen year after year. In 2023, more than 8,000 Canadians died from opioid-related causes, families left shattered, communities forever changed. The crisis has become a public spectacle. Parks and alleys serve as makeshift clinics as users inject in full view of passers-by. Discarded needles are found in playgrounds, bus shelters, and even libraries. Paramedics and emergency room staff face trauma daily, sometimes reviving the same person multiple times. For the children growing up in these neighborhoods, scenes of suffering and loss have become routine. Communities and governments have scrambled for answers. Naloxone kits are now distributed in schools, offices, and homes, empowering ordinary citizens to save lives in moments of crisis. Outreach teams, often led by people in recovery, work around the clock to build trust, deliver care, and offer hope. Yet not everyone supports harm reduction. Political debates erupt over whether funding should go to treatment or enforcement. But evidence consistently shows that harm reduction saves lives, reduces the spread of disease, and creates a bridge to recovery for many who would otherwise be lost. The opioid storm has forced Canadians to confront hard truths about addiction. The old war on drugs model has failed. Punishment and stigma only drive people further from help. Chapter 3. Hotspots. Canada's new epicenters. The human cost of Canada's crisis is felt most acutely in certain hotspots, urban neighbourhoods where the pressures of poverty, addiction and homelessness collide. Nowhere is this more visible than Vancouver's downtown east side, a community both notorious and misunderstood. Here, entire blocks are filled with makeshift tents, lines of people waiting for food or medical attention, and storefronts left vacant by business flight. Toronto's Moss Park, the area around Montreal's Berry-UQAM metro, and pockets of Edmonton and Winnipeg echo the same story. These places have become the epicenters of visible suffering, not by accident, but because of years of neglect, failed policies, and the clustering of low-cost services. Easy access to transit, shelters, and harm reduction sites draws those in need, but also concentrates poverty and addiction in ways that are hard to manage. For residents, daily life is shaped by fear, compassion, and exhaustion. Small business owners report declining sales, rising vandalism, and growing frustration at the lack of coordinated response. Local families navigate a landscape where their children may witness violence or step on discarded syringes on the way to school. Meanwhile, tensions rise between housed and unhoused neighbors, each feeling powerless to change the situation. Cities have tried to meet these challenges head-on. In Vancouver, mobile medical clinics and peer-led outreach teams work side by side with law enforcement to keep people safe. Toronto has piloted housing-first buildings near encampments, and Montreal is experimenting with wraparound support programs that link shelter, healthcare, and job training. Non-profit groups and faith organizations provide vital services, hot meals, crisis counseling, and a sense of belonging for those left behind. Despite these efforts, demand always exceeds supply. Chapter 4. Root Causes. Why it's happening. Beneath the visible crises on Canada's streets lies a matrix of root causes that have gone unaddressed for too long. The most immediate factor is housing. In city after city, rents have soared past the reach of low and even middle-income families. Social housing waitlists stretch for years, leaving thousands without options. At the same time, steady jobs with decent wages have become scarce, replaced by contract work, part-time positions, and precarious employment with little security. But economics is only one part of the picture. Trauma, mental illness, and addiction often begin in childhood or adolescence. Indigenous Canadians, shaped by generations of displacement and discrimination, are especially at risk, with overrepresentation in both homeless and addicted populations. Youth leaving foster care, women fleeing domestic violence, and veterans with PTSD also find themselves on the streets with nowhere to turn. Too often, society reacts only when crisis hits. School systems may miss early signs of learning disabilities or behavioral disorders. Medical systems are slow to diagnose and treat mental health conditions, especially for those without private insurance or a family doctor. For many, the cycle of poverty and exclusion begins with small setbacks that are never addressed, compounding over years until the system finally notices when it's already too late. Some communities are shifting toward prevention. Affordable housing projects built with public and private investment offer stable homes to those at risk. Early mental health screening in schools, increased support for families in crisis, and culturally sensitive outreach for Indigenous youth show promising results. Pilot programs for basic income have reduced homelessness and reliance on emergency services in some regions. The lesson is clear. Investing in prevention costs far less and achieves far more than endless crisis response. Countries that have made housing, healthcare, and education basic rights rather than privileges have fewer people living on the edge. Looking ahead, Canada must prioritize policies that address these roots, not just symptoms. Chapter 5. Inside the system, what's being done? As public pressure grows, governments at all levels have taken action, some bold, some flawed. Billions have been pledged through the National Housing Strategy, aiming to create new affordable units and repair old ones. Provinces have rolled out mental health funding and pilot programs for addiction treatment, while cities race to build new shelters, convert hotels, and open drop-in centers. The response is massive but also messy and fragmented. People seeking help often face a maze of agencies, each with different rules, eligibility requirements, and wait lists. Many slip through the cracks, bouncing from shelter to hospital to jail, never finding a stable solution. Some cities have built one-stop service hubs, where housing, healthcare, legal advice, and job support are available under one roof. These integrated models show real promise, but are not yet widespread. Frontline workers, from social workers to paramedics, carry an enormous load. Burnout, compassion fatigue, and lack of support are common. Volunteers and non-profit staff fill crucial gaps, but often operate with limited funding and little political support. Coordination between government, healthcare, law enforcement, and non-profits is essential, but sometimes undermined by turf wars or shifting priorities. Innovation is happening. Housing First programs, proven in other countries, are reducing chronic homelessness in Canadian cities. By giving people a stable home without preconditions, regardless of addiction or employment status, these programs allow individuals to focus on recovery, job training, and rebuilding their lives. Partnerships with private developers, faith organizations, and community groups multiply the impact of government dollars. Canada's system is learning, albeit slowly, that collaboration, humility, and listening to people with lived experience lead to better results. People who have been homeless or struggled with addiction know what works and what doesn't. Their insights are invaluable and must be at the heart of every new policy. The future depends on sustained investment, strong leadership, and a commitment to evidence-based action. Funding must follow success, not just political expediency. Governments must move beyond band-aids to systemic reform, treating homelessness and addiction as complex, chronic issues requiring integrated solutions. With the right vision and commitment, Canada's system can become a model for others. Chapter 6. Controversy and Consequences. No crisis this large is without controversy. The visible presence of supervised injection sites, safe supply programs, and tent encampments has split communities. While many see compassion and progress, others fear rising crime, declining property values, and a sense that their neighborhood is slipping away. These divisions are stoked by sensational headlines and political posturing, with each side convinced they know the solution. In areas near shelters or harm reduction sites, business owners often report break-ins and declining foot traffic. Parents worry about safety and cleanliness. Neighborhood associations sometimes organize to block new facilities, arguing they attract trouble and do little to solve the underlying problem. This not-in-my-backyard mentality has delayed or derailed much-needed projects. Leaders face immense pressure to respond. Some lean into law and order strategies, clearing encampments, increasing police patrols, and pushing for stricter enforcement of public order laws. Others double down on harm reduction and social investment, arguing that safety comes from support, not punishment. The debate is fierce and the stakes are high. What breaks the stalemate is honest, evidence-based dialogue. Communities that bring all voices to the table, housed and unhoused, business and non-profit, police and peer support, find creative compromises. Security measures, neighborhood cleanups, and well-designed facilities can reduce public concerns. When people see the real stories behind the crisis, empathy often grows. The lesson is that fear can paralyze, but understanding can unite. Chapter 7. Hope and Recovery, the Human Side. Despite the challenges, stories of recovery and resilience light the path forward. Many who once faced homelessness or addiction now serve as counselors, peer outreach workers, and community leaders. Their journeys are never easy, marked by relapse, setbacks, and countless obstacles, but they prove that with support, change is possible. Programs that center lived experience, such as peer-led support groups, second-chance employment, and micro-housing initiatives, have shown real promise. People in recovery are often the most trusted guides for those still struggling, able to connect with empathy and understanding that no textbook can provide. Communities that celebrate these successes foster hope, not just for individuals, but for neighborhoods and cities as a whole. The path to recovery is long and fragile. Many face stigma from employers, landlords, and even family members. Accessing healthcare, stable housing, and meaningful work can take years. Yet, each small victory, every job secured, every family reunited, every person who moves from the street to a safe home, creates ripples that inspire others. The lesson is clear. When given dignity, stability, and opportunity, people can transform not only their own lives, but the lives of those around them. Every success story is a testament to the power of investment, trust, and patience. Scaling up these solutions is Canada's next great challenge. Policymakers, philanthropists, and ordinary citizens must support and expand programs that work, amplifying voices of hope and possibility. Volunteers, employers, and community leaders must remain steadfast, even when progress is slow. A nation is judged by how it treats its most vulnerable. By embracing the mission to restore dignity and belonging to all, Canada can turn its greatest crisis into its greatest triumph, building a society where no one is left behind. Conclusion. The story of Canada's struggle with homelessness and drugs is still unfolding. Its causes run deep and the challenges are formidable, but the solutions are within reach. As the crisis continues, it will test the nation's resolve, compassion, and willingness to learn from both failure and success. If this crisis is ignored, the costs, human and financial, will only grow. Cities may lose their character, safety, and sense of community. But if Canadians choose action, innovation, and partnership, a different story is possible. One of resilience, hope, and shared prosperity. Every Canadian can play a role. From volunteering or donating to advocating for better policies, even the smallest actions matter. Communities must demand accountability, push for evidence-based solutions, and hold leaders to their promises. The greatest lesson of all is that collective action works. When people come together, challenge old assumptions, and invest in what matters, they change not just statistics, but lives. This is Canada's moment to rise. If you believe in a better future for everyone, like, share, and subscribe. Tell us your ideas, stories, and hopes in the comments, because the fight for Canada's soul belongs to all of us, and together we can make a difference.